Push his ears.
Many people don't realize African American women have a greater risk in the earliest stages of motherhood. Even Black women themselves, like Danielle Bryant, are too often unaware of the threats.
So I had never associated a life-threatening situation with pregnancy and delivery.
Danielle learned the truth firsthand as she was rushed to the hospital in labor at just 6.5 months pregnant.
I had internal bleeding that was not controllable. I had 23 transfusions, and my son, unfortunately, he suffered some brain damage.
Danielle's mother stayed by her daughter's side.
And I immediately started calling people to pray with me and to pray for her, because I realized that something serious was going on, and found out later that she was at death's door.
The CDC says Black women face unusual hardships when it comes to having a baby, regardless of income or education.
We know that Black women are 3 times more likely to die from a pregnancy-related cause than white women. And Black women are also significantly more likely to have a severe health complication at the time of delivery. It's just really important for us to understand that these pregnancy-related deaths, 2 out of 3 are preventable.
2 all too common conditions among Black women that need to be addressed are fibroids, benign uterine tumors that can cause severe bleeding, and preeclampsia, high blood pressure that can be fatal. Black women can also suffer a premature deterioration of overall health due to chronic race-based stress.
And we know that these historical disadvantages that are experienced for Black and Native American women sort of weigh on them over time to something that's called a weathering hypothesis.
Studies show Black infants are more likely than white babies to be stillborn, born premature with low birth weight, and to die before their first birthday. Those born before 32 weeks also experience more brain issues. Not all hospitals offer the same level of service. 75% of African American women give birth at hospitals that serve predominantly Black populations. And as it turns out, these hospitals generally provide lower quality maternal care. Patient studies and experiences also point to racism among some healthcare providers.
I have experienced bias and racial bias, and I have I had a stillborn child. Her name was Kennedy. And when I was pregnant with my second daughter, who did survive, Riley, I experienced so much bias that I had to switch doctors in the middle of my pregnancy at 6 months.
Her loss prompted Heather Wilson to start a nonprofit called Kennedy's Angel Gowns, making burial clothes for babies lost during pregnancy. And the prejudice she felt made her reach out on social media to see if other Black moms could relate. Overwhelmed by responses, Heather started an online support group.
When you reach out and women are having the same exact experiences, you can't help but think this is not a coincidence.
A 2016 study published in the Proceedings of the National Academies of Science revealed half of medical students and resident physicians held false beliefs, such as Black people's nerve endings are less sensitive, skin is thicker, and blood coagulates more than white people's. In 2021, Wilson joined a Black maternal health roundtable discussion with Vice President Kamala Harris.
What's the source of the anger and the sadness, and what are those conversations? Not being heard
is the number one thing I hear. They're not listening to me, and oftentimes it's too late.
The Biden administration has proposed increased spending to improve Black maternal health, such as providing Medicaid coverage for up to a year after giving birth and paying for personal advocacy workers called doulas. Since that proposal was part of the defeated Build Back Better bill, its future remains uncertain. Meanwhile, medical schools now incorporate anti-bias training into their curriculum, And many healthcare agencies take advantage of free online courses offered through the Health and Human Services Department. Elsewhere, the CDC website offers lots of pregnancy-related information for Black women, such as how to recognize warning signs and guidelines to choosing the right hospital and doctor.
You have the right to interview your doctors, ask them the questions that you need to know. I would even ask, especially as a Black woman, what kind of experiences have you seen, do you have with people like me?
So while these various issues facing Black women can lead to devastating consequences, African American mothers are drawing attention to their plight and are fighting for change. Lorie Johnson, CBN News.